Welcome home. We are WNST, AM 1570, Towson, Baltimore. We are Baltimore Positive, positively getting the Maryland Crab Cake Tour back out on the road. We'll be at Planet Fitness in Timonium this week on Thursday. Next week, we're doing the crab races in advance of Preakness Stakes. We'll be down at Lexington Market. I think it's like the 47th year they've done the Crab Derby down there. Ivan Bates is going to come by and talk law and order. Also, the Yankees in town. Hopefully, they don't have the brooms out for us again. I will have these out. These are the Maryland Treasures, Maryland Lottery scratch-offs. We'll have those to give away next week at Fadley's. Also on the 21st in Catonsville at the Fishmonger's Daughter as we christen the new location for the Fadley's family out on Frederick Road. I got my own special table out there. Also brought to you by our friends at GBMC, where I walked a mile in their shoes last month. They are our partners. I had a real checkup, and if I showed Dr. Delanois I took a needle right here. She told me I had beautiful veins. I'm like, get me out of here. I actually had a real doctor's appointment last week. I had a colonoscopy 6 months ago. So Christina, Greg, everybody over at GBMC trying to save my life and keep me on the up and up. So this week, we're going to do orthopedics. We have Dr. Ronald Delanois. Say it the French way because it rolls off of you. I just came back from South America. I'm working on my Spanish, Doc, you know?
That's all right. That's all right. The French pronunciation is Delanois, which is very
Delanois.
difficult. Yeah, it's close. Very difficult to say. So most people just call me Dr. D. That's probably the simplest way to remember my name is Dr. D.
Well, for anybody listening out on AM 1570, you're driving around, you need to go to the video on this because you have you have a vibe. You have like a total old school,
I'm an old
sort of
guy.
your old school vibe about you. Orthopedics is not fun, and it usually involves a lot of pain for the guy on the other end, like me. I've been called in on joint this and knee this and elbow that. I'm 57. I've never fallen out of a tree and broken anything, but so many of my friends are seeing folks like you about knees and joints and hips and
Yep.
things where they're just miserable in their golf game or injured in their pickleball game or just trying to get up and down steps like I was 5 years ago. And I mean, it's scary coming to the doctor. And I think part of the fun is what we're trying to do here at GBMC, saying, hey, man, you got to get this. It's not fun, but you got to do it. You got to get in. You got to, you got to get your body checked out.
I agree, 100%, 100%. I think that what we're trying to do here at GBMC is take a more of a inclusive, comprehensive approach toward orthopedic care and the prevention of injury for our patients, and that's the entire spectrum. When people talk about knee injuries, they tend to focus on the young athlete, and we all think that we're still young as we get older, but we want to consider ourselves continuing to be active. So, how do we stay active? How do we stay healthy? How do we prevent ourselves from injury? And we're looking at that from the entire spectrum in GBMC because we think that's what's really, really important. Our population is getting older. We recognize that. The baby boomers are accelerating. The fastest growing population is actually the octogenarians. And believe it or not, you know what they want? They want to remain active. They want the same thing you're saying right now, which is they want their knees to work. They want to have pain free. They want to be able to play pickleball and be active because that's what life is about. Life's about quality. We can't determine quantity. That's up to the good Lord, if those of you who have faith. And the rest of it is all about us. How do we maintain our quality?
You seem like you've been at this a couple of years, and I would think that when I was a kid, I remember when I had my appendix taken out in 1986. So we're going back, it was 40 years ago this month. I had my appendix taken out. I mean, I got a scar this big across my stomach and doing sit-ups for years. And I was 18 years old when it happened. I'm just thinking like of all of that. And maybe that's one of the reasons I try to avoid doctors, that there, every person that I know, and I know a lot of old people that have had knee and hip replacements. And I'm
Yep.
in. Rick Vaughn's coming on next week. Old Oriole PR guy. He, a couple weeks ago, he's like, I'm having my, and I'm like, every person I know, Marvin Lewis, my dear friend, head coach, yeah, they've all said to me, is the best thing they've ever done after they've done it because you guys are better at doing it than you were 30 or 40 years ago, and getting you back to full health. And I did PT last week. We should be doing PT every week. But the notion that we know how to do this and it's going to hurt like hell for a minute. We're going to give you this. You're going to do this, but you're going to do that. And hey, by the end of summer, you're going to feel better than you feel right now, which is creaky. And I think a lot of people fear that part of it, but I've heard so many on the other end of people, even older than me, who've been overjoyed at the experience they've had by finally putting themselves through when they have insurance and have all of these things. That modern technology and doctors like you're doing it differently than maybe you did it in med school.
Well, there's no question. First of all, we didn't do it in medical school because we weren't allowed. So we'll just say that. But as the profession has evolved, as everything has evolved as time goes on, right? The operation has improved in many ways, specifically hip replacements. We have a multitude of approaches that really try to address the patient specifically. Patients like to think, the most popular approach today is what's called the anterior hip approach. People have a misnomer of what that actually means. What that really means is some muscle sparing approaches. There's at least 2 to 3, and maybe even 4 muscle sparing approaches that surgeons utilize based on patients' overall anatomy. And we have to emphasize that because I think patients come in looking for a procedure. What they should really be looking for is the right operation to give them exactly what you said, which is quality, right? They want to return back to activity and what they view as normal living. So that's number one in terms of hips. In knees have done a tremendous evolution. We've changed the plastics, we've changed the materials. The approach actually hasn't changed so much, but we now incorporate robotic technology to help facilitate. So we have a lot of different ways as we're continuing to chase what we call the normal knee. The normal knee is what we want. The hip is an easier joint where patients feel normal after the operation. They forget about it. Knees, not always the same way. So we, as academic orthopedic surgeons, as people who are interested in this topic, one of which is myself, and I've published quite a bit in this space. I think we really are trying to understand is how do we recreate that patient experience similar to the hip where that knee feels essentially normal. And robotics is going to help us get there. It's not quite there yet, but it's going to try to help us get there as we try to and as we and I can go on in terms of all the different technologies, different approaches, different the ideologies in terms of how to approach a knee replacement. But the goal is to give somebody a knee that they don't have to think about, that they can go on and be fairly active, right? Now, there's always limitations. I'm not a fan that you can go back and ski 55 miles an hour downhill ski like Lindsey Vaughn did. But God bless her. She's an unusual individual. She's a beast, and God, and she's in many ways unstoppable. But that's not the normal person. The normal person, what they're looking for is increased quality. They want to return back to being able to be active and have a good remaining portion of their life.
Dr. Ronald Delanois is here. He is with GBMC. He is an orthopedist and orthopedic surgeon, and as well as for joints and knees and things like this. I had chondromalacia in my right knee. I played a lot of tennis. I was a catcher in baseball, so a lot of squatting and that sort of thing. I'd like to think I'm in the best shape of my life now because I'm smarter and much more dedicated to being in shape than I was when I was 25. But normal knee when the weather gets weird, like
Yep.
my mom would talk about arthritis back in the day when the clouds would come or when the barometric pressure changes or those kinds of things. My knee feels better, knock on wood, knock on anything I can find, than it has in years in regard to me walking through cities. And I just did this South America tour. I'm walking 15 miles a day everywhere. But hills, weird things, cobblestone, things that moved me a little bit. I feel it, but I don't want to come see you and talk about replace this and that. I don't know what normal is or what point I'd say, well, I'm uncomfortable. I'm going to take a couple of Advil or take a little bit of this to get the swelling down or whatever if I walked a little funny or if I turn it a little funny. But the difference between having that surgery now 20 years ago for me, it was June of 2006 that I had that, to thinking like maybe one day I would really need you. I'm cool right now. At least I feel that way, but I'm not even sure what the normal aging process is for these kinds of things because I'm not afraid of having it done now that I've had so many friends say, if it ever gets bad, but I'm not looking to downhill ski. I'm not looking to run a marathon
Right.
anymore.
Right. I think that that's the right approach. I mean, I think people have a fear of physicians because they think, especially surgeons, because they think that the only thing the surgeon wants to do is actually operate. We're like you. right? We have families, we have loved ones who are at different age points in their lives, and no one's chasing an operation. At least I like to believe that for the majority of orthopedic surgeons out there. And what that means is that essentially what we want to do is the right thing for you. And sometimes what that means is just simply educating you on what your problem is and what activities you can do differently to remain active. So what I tell people is, some people are avid runners, but running is getting harder on their knees. Well, then you transition. You transition to trail running, which is a little bit easier on your feet, or you get different shoe wear. Maybe you transition to walking briskly. You can still remain active and evolve and change because we all do. That's the part of normal process. That's aging, right? It doesn't necessarily mean that you have to have surgery. So don't be afraid to come and see us in orthopedics at GBMC because really the reality is what our goal is to keep you active and I will tell you, the majority of patients that we see, we do not offer or recommend surgery. We actually emphasize non-surgical techniques to make sure that you can remain active. And that's our goal. There's a plethora of new things that are coming out. Great. Everyone's heard of cortisone shots. That's very common. People have heard about gel shots. That's very common. People are now thinking of alternative medication. There's some debate on that, and I'm happy to expand, but I don't think we have time. There was a Stanford study that just came out that is very much in the preliminary stages. I spoke to the vice chair. He's a good friend of mine at Stanford. And I said, tell me about this. I see one of your PhDs has actually developed the ability to inject stuff to make your cartilage regrow on the actual knee. Right now, I think that's going to be something that we can potentially use for young people more so than old people who have other bony changes. But that's an evolution that's going to happen at some point in time where we'll be able to hopefully prolong the knee as we've done in other areas. Just think of it as like cancer. There are certain cancers in the past that were fatal very quickly. Today, people are living with those types of cancers for a long, long time. And we can go on and on in terms of that. We see arthritis as the same thing. We're just on a different spectrum. We have good solutions today, good replacements today, but our goal at the end of the day is to hopefully prevent the need for a replacement and allow you to keep you what you have and allow you to remain active. And that's our model here at GBMC is really how do we keep you doing what you want to do?
Well, I don't want to throw a baseball at 101 miles an hour, but I would think guys in your line of work, and I've had Dr. Frank Joby on back in the day. I've done sports for 35 years. So most of the time when I'm talking orthopedics, it's about how do we get this football player or this baseball player back to doing what they do. But
Correct.
the soldier part or the shoulder part of this, and I had a rotator cuff issue maybe about 25 years ago when I was a young guy on my left side, and I'm right-handed, and I had the rubber thingy that on the attached
Yep.
to the doorknob and strengthening and all of that. When you see what athletes put themselves through, stuff that in your line of work is sort of like, they're just going to be coming to see somebody like you. Pitching's one of those things that I think, from a sports perspective, for my audience, it's not normal, right? What these guys do.
Well, exactly. I mean, I think that when we try to compare ourselves and say, wow, that professional athlete was able to return back to activity much more rapidly than I was. Does that mean he had a better doctor, a better therapist? Not necessarily. And I'm not necessarily sure that that person should have returned back to activity as quickly as they did. They're in a business, right? We have to recognize that. And sometimes there are things that happen behind. Return back because and state that they're normal when they may not be normal. We see that all the time, right? The reality is that the human body heals at its own rate. Yes, the younger you are, the faster you heal. Most athletes are young men and women who have still that ability to heal more rapidly than the majority of us who are now seeing orthopedic surgeons. The average orthopedic surgeon is not seeing the 20-year-old. Yes, some of our sports physicians who are dedicated to sports athletes will be seeing more frequently those injuries that do oftentimes require surgery. We have a surgeon here, Dr. Malagari, who does that as well, does a fantastic job. Absolutely 100%. But again, the majority of us are trying to, maintain activity and stay active and stay healthy without surgery. Now, I will tell you, surgery, when done and done properly, is a fantastic operation. We like to do that because we like to give patients back that pain-free activity. That's why they've come to see us. But that isn't our first line of defense. Our first line of defense is education, and then giving you a plethora of modalities to include physical therapy. Sometimes, today in orthopedics, we're talking about the psychology of pain. How do I help you manage pain better so that you aren't looking for surgery? You mentioned rotator cuff shoulder surgery. The evolution used to be every rotator cuff operation, every rotator cuff tear should be fixed. Today, that isn't the case. We don't look at that as the absolute end all be all, because not every rotator cuff should be fixed because the data doesn't support that. So it's again, as you mentioned earlier, the specialty is ever changing. We like to believe at GBMC we're at the forefront of that change, and we think that we can provide the best care possible to the patients of Baltimore, Towson, and all of Maryland.
I got to make you laugh here. Dr. Ronald Delanois here from GBMC. So I've seen an orthopedist once, maybe in the last 15 years, and it was because I was having an issue with my right arm in picking up pots and pans. I had like it
Lateral
felt like a
condylitis.
exactly.
Yep.
I knew you would know. So I went in and the doc said to me, like literally was examining me and said, "How do you sleep?" And I'm like, I sleep balled up. I sleep on my stomach exactly the way my chiropractor tells me not to. So everything I was doing were these dumb habits. And he said, "You're sleeping on your elbow. You're curling your arm up underneath of you." Gave me like this thing that Springsteen wears, this wristband thing when he plays
Mhm.
guitar to like lock in. And I looked at the doc like, me with a bad habit? How could that be possible? But I just wanted to give you a little bit of oxygen to talk about that, laugh at me, because like habits and like the kind of shoes we have and the way we're walking and the way we do things will affect all of this. And even after my right knee surgery, I had no idea about left and right balance, but it took me about 2 years after I had surgery 20 years ago to just get my right and left organized again to get my strength back because I got so whacked out. But for me, the part of bad habits, sleeping on my stomach, just doing all of these things that were wrecking my body that when I was 25 didn't bother me. When I got to be 45, it started to wreck me a little bit.
Right, and that's what you're describing is exactly what we're focusing on here at GBMC, which is the total patient, right? The total patient is not just the injury located in your elbow. It's really about as you described, many other aspects. How do we change behavior? How do we educate you and the elderly? You talked about hip and knee replacements. How do we teach them to have a safe home so that they don't fall? Because fall risk is a catastrophic issue as you get older because it really could change your life significantly. How do we ensure that we give you the right nutrition so that you don't develop early onset osteoporosis, osteopenia? Those are the types of things that we're trying to focus on, build a structure here at GBMC that allows us to take care of the patient from the beginning to end and really provide that complete service. And so I think that's what we're excited about. We're excited about taking on orthopedics very differently than the rest of the community in Baltimore is, which is very isolated. You got a knee problem, go see a knee doctor. You're gonna see here at our facility. You're gonna see us as a team, and our team is not just the orthopedic surgeon. It is everyone. It is the physical therapist. It is the social worker. It is the psychologist. It is the endocrinologist. It's the entire team of people who are focused on returning the patient yourself back to the quality of life that you choose, that you want.
I'm not breaking any HIPAA violations here because it's my medical record, but I had my real checkup last week. I gave real blood. And the next day I got right on my chart, which I'm getting all hipped up to my chart now and stuff. The first word from the doc was unfortunately, and it led to we need to make some lifestyle adjustments. So I've already been spanked once this week, doc. So I'm going to let you hit the road and get back, take care of your patients. But I ain't afraid of you. I'm letting you know
That's all
this
right.
knee,
Don't want
if
you to
this
be.
back, if this shoulder, if this hit, because it's all been messed up at some point. So I know it's only a matter of time because I am active, but I'm trying not to overdo it and trying to avoid you,
You
although
look
I know I
great.
can't.
Keep doing what you're doing. I love the energy. I'm sure you'll be fine.
I'm going to get a shirt that fits me as well. I did the 11th annual Walk a Mile in Their Shoes with GBMC last month. Danny's going to come on and talk about that. Right now, we have Dr. Ronald Delanois with the great hat and the great bow tie joining us here on the Zoom. Always a pleasure to have all the docs on. Keep up the
Thank you
great
very
work and
much.
helping people. And I just want to let you know, I'm not afraid of you. And if I have to come see you because of this knee, I'm going to come, and I have a feeling that you'll be there to help me.
Absolutely 100%. We all will, my entire team. No questions about it. Come and see
Appreciate it.
us.
And I won't be afraid of you on Zoom or otherwise.
Sounds
Dr.
like a plan.
Ronald Delanois is here. I hope I'm pronouncing that good. I think I
You're
worked it
doing
through
fantastic.
over 25
Fantastic.
minutes. You can find him and the great team over at GBMC. They are sponsoring our Maryland Crab Cake Tour along with our friends at the Maryland Lottery. I will have the Maryland Treasures to give away this week. We'll be at Planet Fitness, where I'm trying to get stronger all the time. We'll be in Timonium for that this week on Thursday. Next week on Wednesday, we're at Fadley's at Lexington Market for the back end of the Yankee series. And then on the 21st at Fishmonger's Daughter. Also brought to you by Farnan and Dermer. They are our HVAC partners in plumbing. 410-367-7777 to find them. And of course, they sponsor all of our sports stuff, including all of those injuries that the Orioles have right now that Luke will keep us abreast of. I think sometimes our WNST tech service, brought to you by Cole Roofing and Gordian Energy, is an injury report list. Certainly hoping to get some of these Orioles players back out on the field. I'm back for
Absolutely.
more on Baltimore Positive. Stay with us. We're AM 1570, Towson, Baltimore. We never stop talking Baltimore Positive.